Joining us now here on Capitol Journal is State Representative Merika Coleman. Representative Coleman is a Democrat from Birmingham. Thank you for joining us here.
Thank you for having me.
I want to first start off with what are some of the bills that you're really trying to push this session through?
Well, I have three that I really feel that are very special to me, and then that we have some hope that they may pass this year. I have a bill that was brought to me by one of my young constituents, and it simply says if you have or own a vicious dog, that you have a beware of dog sign. He was attacked by a neighbor's dog, and his parents just didn't know that they had one of those vicious category dog, and I told him that I would push that on his behalf, so we were hopeful on that bill. In addition to a bill that I just passed out of the Health Committee today. We're in hard times right now, hard economic times, and we know that hospital bills have often caused people to have to file bankruptcy. But the hospitals have financial assistance programs that some folks don't even know are available. So what my bill simply says is that hospitals have to disclose what their financial assistance programs are, have a sign available, and have on each hospital bill that goes out, just letting people know where they can go and who they can talk to if they need financial assistance. And lastly, I have carried a bill for the past 3 years that has passed unanimously in the House and has passed the Senate committee, lost it on the very last night last year. It's the domestic violence fatality review teams. And all it is, it's permissive legislation that allows local municipalities or regions to develop these review teams that look at domestic violence. What are the indicators and what can we do to prevent domestic violence fatalities? So I'm excited about all three of those this year and have some hope that we'll get those passed.
How would the domestic violence teams work as far as you say sometimes I guess regional, county is going to be up to the local governments to decide?
To the local government. There are some folks that have these ad hoc committees that have already developed. This will just give it some teeth. We've worked, the AG's office has come in and offered some amendments because the AG would be a part, or his designee would be a part. DHR, child abuse organizations, the coroner office, all of these type of social service agencies that help with people who are dealing with domestic violence. And we hope also there will be someone who has gone through that will give that perspective as well. So, but each one of those localities will determine how it best fits the needs of their particular area, because what works in Birmingham might not be the same thing that what may work in Baldwin County.
What are you trying to accomplish with these teams? What do you hope that they are able to develop that can help with the issue of domestic violence?
To prevent the fatalities. I mean, to hopefully get families help, to make sure that the abuser is taken away from the home, so children are not put into unhealthy situations, and to where the person who is the victim is not put in an unhealthy situation. So we want to look and find out, what are those indicators, what are those signs? Is it even a child that's not attending school? Is it someone who is coming to work with a bruise here or there, is often off sick? We want to look at what those indicators are so we can prevent those fatalities. I mean, one of my favorite singers, Jennifer Hudson, lost her family, and some think that it was one of those situations where an abusive ex-husband at that time. So we want to be able to prevent those types of situations from happening.
On the patient knowing about financial assistance, with this bill, you say hospitals have that, but people just don't know about it.
That's right.
Do you think this would take down people having to file for bankruptcy when they have medical bills? We
surely hope so. The Hospital Association actually helped me with the bill. They are championing the bill also, because they have recognized that, you know, maybe they have not promoted the programs themselves, but they do have money available. Let's get people help who need the help, and hopefully we can help in an economy that is just, you know, terrible right now. So maybe this is one way that we can help.
Because hospitals, if the people can't pay and they declare bankruptcy, the hospitals
they absorb the cost and so on and so forth. So, you know, hospitals are going through a lot right now as well. Not a lot of hospitals in this country are actually making money. So hopefully we'll be able to help each other.
I want to talk some about the budgets. Yeah. I know one of the things that's been kind of delayed on working on the budgets, waiting to see what comes down with the economic stimulus package. How do you feel about the package that's been passed as far as what you know and how it's going to help the state craft budgets?
Well, you know, we have been waiting And we did kind of get a spreadsheet yesterday of what amount of money would be available for Medicaid, food stamps, and other programs, education, a huge help, infrastructure projects. We know as a state it will be very helpful to us over the next 2 years to be able to plug the holes that we've had. I mean, I'm a part of the leadership team, and we were talking about prior to the stimulus package how in the world we were going to be able to save the state budget, having people to make those hard decisions about programs that may have to be cut, worthwhile programs that may have to be cut. So I'm glad that President Barack Obama has taken the initiative along with this Congress to pass something that will help people, but it doesn't fix the problem. We do still have to recognize as a state that in order for this not to happen again, we may need to reevaluate how we raise revenue and so on and so forth in the state of Alabama. So a little bit shocking though that Governor Riley has decided or talked about not taking the unemployment money, which is, of course, helps those folks who are unemployed or underemployed. So I would urge him to rethink that. From my understanding, he has about 45 days to make that decision. And we are also working as a legislator because one of his challenges he felt was having to change state law. So we're talking about that as far as the leadership team to see what folks are willing to do.
Because I know Alabama's the unemployment compensation we have has been one of the lowest in the country and was raised some, I think, a couple of years ago. Right. But even before then, it was like, so and where do we stand when it comes to the unemployment compensation we actually offer people right now?
Well, all of this would just really offer another $25 a week to folks, which doesn't sound like a lot to some people, but that's additional meals, prescription drugs, I mean, things that could really help folks. In addition to expanding the amount of time that people can stay on unemployment or receive those benefits. Again, when jobs are leaving, which we've happened. I had one of my colleagues talk about 3 different industries that announced a few weeks ago that they were leaving his county. We have to have some kind of way to help people until this economy stabilizes. So I hope that he does reconsider, and I will lend his support if that he needs and the legislature needs, so we can be able to draw down those funds as well.
You mentioned that the stimulus package trying to prevent a hole right now, but it doesn't deal with. Do you think the state needs to look at tax reform, a comprehensive looking at, when you say looking at the way we collect taxes?
Right. Of course, we've tried that since I've been in the legislature to do comprehensive tax reform. Unfortunately, I thought at that time maybe it was a little bit too cumbersome. Yes, I think we do need to look at how we do property taxes in the state of Alabama. I'm excited, though, since we're talking about taxes, that we are entertaining taking sales tax off food, at least the state portion, for people, because, again, folks are hurting. And this is a way to put additional dollars back into folks' pockets. But, yes, at some point, as a state, we're going to have to look at some of the things that may even be unpopular. Ways that we can raise revenue, and some of those things that, of course, that we've heard about are some of the sin taxes and maybe gaming in the state of Alabama, which some folks don't think is popular, but we have to raise revenue some kind of way. If you don't support gaming, then don't go game. Don't go.
In tax reform, would you try to see of a measure that would be more revenue neutral as opposed to maybe necessarily increasing the amount of money, but at least revenue neutral? Because sometimes that's been the criticism.
That has been the criticism.
That the tax reform is really a reason to raise taxes as opposed to we're trying to just raise the same amount of revenue but do it in a better way.
Right. Well, I think you maybe should call it revenue redistribution. Of course, our president was, by some of his critics, said that was the wrong terminology. But we do need to look at the percentage at which we tax low-income people versus people who can make a little bit more. So I think we do need to look at redistribution of wealth. For people that have more of an ability to pay, they should pay. And I'm going to stop there.
No, right. Don't want to go into some areas to get into trouble with right now. Well, Representative Coleman, I appreciate you joining us here on Capitol Journal and look forward to talking with you about the continual passage of the bills that you're pushing and also other measures before the legislature.
Well, thank you so much.
Thank you.